Hi, I'm Erika Satterwhite, Head of Global Policy at Viatris. For those who are not familiar with Viatris, we are a global healthcare company with a mission to empower people worldwide to live healthier at every stage of life. Our diverse portfolio of medicines spans acute and chronic conditions, infectious and non-communicable diseases, bridging the divide between generic and novel therapeutic solutions to more holistically address healthcare needs globally. We are excited to sponsor today's webinar titled The Power of Partnerships to Address Antimicrobial Resistance, as it's a highly relevant topic, not just for Viatris, but for the industry overall. No one company or entity can tackle the issue of AMR alone. Partnerships and collaborations are critical to tackling the problem together, which is why I'm thrilled to have two experts on the topic as part of this discussion. We have Melissa Mitchell with the AMR Industry Alliance and Dr. Yehoda Martei. Melissa, could you start off by introducing yourself?
Great. Yes, hello, and thank you so much, Erika, and thank you to Viatris for hosting this important discussion today, and to NASDAQ for providing this platform to talk about this issue of AMR. And there's really not another issue as detrimental to the health of our planet as antimicrobial resistance, and yet it still remains so under the radar. So it's really important to have conversations like these. So I serve as the Secretariat Lead for the AMR Industry Alliance, and in this role, I'm honored to represent a collective voice of the life sciences industry and leaders across that industry in the fight against AMR. Our membership at the AMR Industry Alliance uniquely represents the major subsectors across life sciences, and it includes about 100 companies and trade associations across sectors in the health space, including small and medium-sized biotechs, large R&D pharma companies, diagnostics companies, and generics companies like Viatris, including Viatris. The alliance was created in 2017 in response to the United Nations call to action on AMR, and this unique group came together to take action and to represent a private sector voice. And we report out regularly on our collective in this fight against AMR, and just really pleased to be here. Thanks, Erika.
Thanks so much, Melissa, for joining. Dr. Martei, over to you.
Yeah, thank you so much for having me join this panel and offer some clinical insights. So I am a medical oncologist, and so primarily what I do is treat cancer patients with systemic therapy. So these are either oral therapies or IV therapies. And we've made a lot of gains in that domain, but I think one of the challenges that we have that face a lot of our patients is the issue of antimicrobial resistance, because our patients tend to be more immunocompromised, so have impaired immune function, and so are at high risk of these infections. And so, I do research as well, sort of related to other issues that are non-AMR, but realize that, regardless of what specialty we are in, AMR is something that affects a lot of patients who are admitted to the hospital who we treat. And so I'm really excited to be a part of this panel. I realize it's sort of a multi-sectoral discussion, and I'm hoping that by offering some of the clinical insights to give you a picture of how AMR impacts people, it would inform some of the conversations and solutions that we'll talk about later. So thank you so much for having me join this panel.
Thank you so much for being here. Let's get started. Melissa, maybe you can kick us off by explaining, what is AMR?
Of course, as a non-scientist and a non-medical professional, I'm really happy to provide kind of a layperson's description of how we talk about AMR with policymakers and general public. And I think Dr. Martei can probably provide a little bit more of the clinical explanation if that is needed. Well, antibiotics are really an essential part of modern life. We've come to know and depend on these. And if you get an infection or an infectious disease, if you are going into surgery, you're often treated with an antibiotic. This happens for C-sections or any other type of invasive surgery. Chemotherapy, like Dr. Martei was saying, antibiotics are essential in preventing infections from developing during those surgeries and in treating infections. So AMR occurs when germs hopefully simple terms, germs like a bacteria or virus or fungus evolves in a way that makes the medicines that were used to treat them, makes them stop working. And these germs adapt and become resistant, again, to the drugs that were designed to kill them. And sometimes they're known as superbugs. And this makes it difficult many times and sometimes impossible to successfully treat these infections. So common antibiotics that we use today are essentially becoming ineffective against these superbugs. And if this goes unchecked, it really threatens to undermine the basis of modern medicine. And it can make some medical mainstream advances like chemotherapy and hip replacements and even root canals potentially risky and maybe even deadly. But AMR is recognized as the leading global cause of death. The latest research reveals that annual deaths associated with bacterial AMR were nearly 5 million, and 1.27 million of which were directly attributable to AMR. And those are numbers from 2019. And earlier data suggests that that number will rise to 10 million deaths annually by 2050. And this puts bacterial AMR squarely on the top 3 causes of death, following heart disease and stroke. And that's not even accounting for fungal and viral AMR. By 2050, it's estimated that AMR will cause more deaths than cancer, unless concerted efforts are undertaken to counter its progression. And I think a thing to think about as we define AMR is that everyone is at risk. Older people who are more likely to be immunocompromised or more at risk of vaccine-preventable diseases or hospital-acquired infections, which put them more at risk of these resistant infections. Young children are also particularly at high risk, particularly as you look around the world. Globally, there's a lack of antibiotics. So 1 in 5 deaths attributable to AMR are in children under the age of 5. But anyone who has a surgery or an infection or a cut is at risk of AMR.
Thanks so much, Melissa, for that, for painting that picture for us of just how dire the situation really is. Yehoda, I'm hoping maybe you can elaborate on this based on your experience in clinical practice in the US and around the world. How do you see AMR impacting people today?
Yeah, so I think, Melissa, the thing that I like that you emphasize is that anyone can get AMR. I think when we think, most people don't know what AMR is, and the few that know sort of think it's distant, is something that affects other people and not young people, and just really, probably someone has been affected by AMR. And so for patients with cancer, we tend to see a lot of infections due to AMR. What this means is that, these patients are more likely to be admitted to the hospital to treat these infections. A lot of the common antibiotics that we give by mouth can be given as an outpatient. People have gotten things like, try not to be using medical terms, but you've gotten oral antibiotics that you can take at home by mouth and being treated for your infection. What happens with AMR is that the common antibiotics that we give by mouth don't work as well. And so these patients end up being admitted to the hospital. They end up getting really sick. And so these are the patients who end up being admitted to the ICU. For cancer patients, I think this is just really agonizing because they get admitted to the ICU. They're waiting for their cancer to be treated. But, unless we can have good control of the infection, it's just really hard to advance treatment on their cancer. And the wait for, the cancer care team, but the patients and their families all agonizing. And best case scenario, after weeks of delay, we're finally able to start cancer therapy. But patients do die from AMR. And so, I think it's a threat that's present now. Like Melissa said, there are patients who have died in our hospitals in the US that have contributed to that 1.27 million deaths from AMR. But I also think that it's important to recognize that AMR is not confined to borders. And so, there's a story about a woman actually from Ghana who boarded a plane from Ghana to New York and previously had gotten like 2 rounds of antibiotics over the counter for a urinary tract infection that was never tested, had a mid-air flight emergency, landed and ended up in the ICU in New York with like a superbug. And so, I think it's just really emphasizing the need that we pay attention to this locally, but also realizing that it is really a global problem. And another thing that I wanted to highlight is, as much as we like to focus on the human aspect, like 2/3 of antimicrobials are in the agriculture sector. Like it's not even related to humans directly. And so I think an approach that is being leveraged is this concept of One Health, thinking about it as not a siloed challenge, but something that affects humans and plants and livestock and this whole shared environment. But I think you don't have to think hard to think about the impacts that AMR has had on you or someone or even just how it's affecting our environment.
Yeah, thank you so much for that. Such important context about bringing in the human element. And we've come so far in our advances in modern medicine, in large part, thanks to the availability of antibiotics to allow us to do surgeries, to do chemotherapy, and to make these truly miraculous interventions possible in a way. And it's really jarring to hear about, the increasing prevalence of AMR impacting your ability to do that important work. On the point you were just teeing up, Yehoda, about the One Health approach and how we're looking at this, I wonder, Melissa, if you can talk a little bit from your perspective as you see across the Industry Alliance. Is AMR a growing problem that we're seeing globally? And what's driving that we're seeing, if that's happening, if that's growing?
Yes, I mean, absolutely, it's growing. If it's unchecked, it's growing. If we're not doing enough, it's growing. And there are many drivers of that increase in risk of AMR. And some of the drivers include the overuse and misuse of antibiotics in humans and animals, as Yehoda was talking about. A lot of this happens in the animal space, poor hygiene and sanitation in many places around the world. A lack of research and innovation to develop and commercialize novel antimicrobials and to make sure that we're using the ones that we currently have in the best way possible is really critical. The manufacture of antibiotics may also potentially contribute to the development of AMR if waste containing antibiotics enters the water in concentrations that could potentially increase bacterial mutation. Also, antimicrobials entering the environment, again, through agriculture, and that includes through improper disposal of unused medicines can further drive resistance. So even simply how you dispose of your antibiotics. And by the way, if you get an antibiotic for a bacterial infection, you should take the full dose. But what's most important for us normal everyday people to understand is that antibiotics are, again, they're used often where they are not medically necessary or helpful, like far too often, as Yehoda's example was saying. And so such as treating viral infections. So an antibiotic is not going to do anything for your viral infection except contribute to growing resistance. And an antibiotic treats a bacterial infection. So I think as normal everyday people who use antibiotics, I think that's important to think about. And to be effective, you need the right drug at the right dose at the right time. And often an antibiotic that is not ideal treatment for a particular infection is used instead. And this can be due to a prescriber's lack of up-to-date information or because that optimal treatment isn't available, and that occurs in many places. So ideally, the use and selection of antibiotics is tailored to a patient's specific infection condition. And to do that in the right way, we do need the right diagnostic tests to help healthcare professionals identify that optimal treatment, right? So you want to treat what you actually have. And to help also ensure that treatment is available. And in many places, we know there isn't access to the needed antibiotics. And unfortunately, there can be barriers, particularly in low and middle income countries, to accessing both those diagnostics and the types of antibiotics that are needed. And in these cases, an antibiotic that is not ideally suited for a patient's infection, again, might be used, and the wrong treatment only furthers resistance and exacerbates the problem, and it continues to grow.
Thanks so much for that, Melissa. And Yehoda, I'm wondering if you want to comment on this as well. Have you seen the burden of AMR growing in your clinical practice?
Yeah, so absolutely. I think AMR is on the rise. I think, as Melissa said, I think AMR, like resistance, is actually a natural phenomenon. I think what's happening now is that we are seeing an accelerated rate of resistance because microorganisms, these germs adapt And so that's natural. I think we are accelerating it, like Melissa said, because of the way we are not appropriately using it. So misuse and underuse. I like that you mentioned that. You know, some people will prescribe 10 days of antibiotics and you get better after 3 days and you stop it. That is also contributing to the problem. Getting antibiotics for your flu. So, you know, pestering your PCP for antibiotics for the flu is contributing to the problem. So I think there's sort of several dimensions in which this is contributing to the problem. I like the point you made about, you know, the global impact of it. I think a lot of patients in low resource settings are getting antibiotics from their pharmacist without ever getting tested on any sample. And I think that's probably a big driver of the problem. Research in this area hasn't been, you know, as proliferative as other areas. And so when you think about the last decade, there's probably been, you know, 18 new antimicrobial agents developed. This is compared to more than 400 for cancer drugs. And so, you know, I think the rate of resistance is like outpacing by far the rate of new drug development. And I think that imbalance is also contributing to the problem that we see right now.
Thanks so much for that. And really sobering to hear the perspectives around how this is increasing and driving, and particularly, I think, coming out of Yehoda, to your point, that AMR knows no borders, that we're seeing this increase around the world, coming off the back of the COVID-19 pandemic, where we had this really sobering experience of being confronted with a pandemic that knows no borders. I know there's been much discussion that potentially the next pandemic will be of a superbug for which we don't have appropriate means to tackle it. I would love your perspectives on what happens if we can't stop AMR. Let's go to the worst case scenario. What is the impact on human health if we can't stop this? Maybe Yehoda, if you could comment first on how you see this evolving as you think about the role of clinical practice and how you can treat people.
Yeah, I think more people are just going to die. You know, that when Melissa had mentioned about the exponential growth in death rates, and I think we're going to see that we'll have more people who are immunocompromised, so elderly, children, cancer patients, transplant patients dying from infections that we could previously treat. I also think we're going to see a huge burden on the healthcare system. So a lot of people with infections that would have traditionally been treated at home with oral antibiotics would just have to be admitted for a stronger combination of intravenous drugs and other clinical support. Because of the acuity of infection. And so there is going to be a huge healthcare costs associated with that. And this is for the patients who don't die from it. They are going to face different complications from the infections. I also think that, you know, we like to think about the direct human impact because that's what affects humans. But I think when you think beyond just humans and the agriculture industry, there's a lot of discussion and threat to food production if AMR continues to increase. And that creates, you know, global food insecurity, more economic losses. And so I think that direct and indirect impact, but it's even scary to think about it. You know, I am hoping, you know, this is not the path on which we are going to be in 10 years, but it's really scary because I think even common procedures like getting a C-section, as Melissa had mentioned, which, I mean, that's a huge part of the population. So we're not even talking about special groups here, are going to be high risk procedures, hip replacements, knee replacements. And so I don't want to think about, you know, what would happen if we're not, because I think that's just going to be a dire situation. It's going to, maybe it might be the wake up call we need, but I don't think we need to get there. You know, it seems like a silent pandemic, but I think there are ways to address it more imminently. So that worst case scenario isn't something we have to face a few years from now.
Completely agree, Yehoda. Let's not let it get there. I think it's worse enough to have to think about what that world could be, but we shouldn't have to see that in order to act. And that's maybe to the next question, Melissa, to pivot us off of the dark and think about how we reach for the light. What is being done to address this now? The world is not doing nothing. What is happening, and how can we think about those best practices to highlight and spot to then further build the progress?
Exactly. I mean, a lot needs to be done, right, to avoid this kind of dystopian future that could be ahead of us, right, if we're not taking action. And I think just to build on Yehoda's point, in many cases, if it's chemotherapy or a hip replacement, someone passes away from what seems like the procedure. In many cases, like families don't actually know that it was an infection that was actually the cause of death, and that could certainly be prevented. Those are the types of things that are really frightening. So I will move away from that, but that's what always hits me, to say, like, people may not even know, that this is impacting them. And that's why raising awareness is really so critical. So that's part of it. But I mean, overall, addressing AMR really does require multifaceted and collaborative approaches, because there's so many areas of impact. So from policymakers and regulators to scientists and healthcare professionals and healthcare systems, we need to see changes in how we address AMR. And, from an alliance point of view, our members have come together to make sure we are facilitating action and collaboration in 4 key areas. And that's across access, to make sure wherever you are around the world, you can have access to antibiotics and the right ones, appropriate use, so that what we've been talking about here, people aren't using them in the wrong way or prescribing them the wrong way. Research and science, to make sure that we are developing new ones, to have new antibiotics, to make sure that we have the ones that we need to fight as these germs mutate, and in manufacturing, which I mentioned earlier. And together, we help foster coordination and action between the health sector and the government. And we really do kind of hang our hats on working in partnership with a diverse group of leaders to help raise awareness and advance advocacy and action where the private sector has a role. So there are a couple of different areas that I can describe. Certainly in the area of surveillance, we're seeing that more surveillance systems are being addressed, and those are being implemented. And that's really collecting and analyzing and interpreting data related to antimicrobial use and where resistance is happening. And that just gives us better real-time information. It shows us patterns. And so better information is always going to be better and can help guide in the development of targeted interventions in specific areas. I think another important area is how healthcare systems and beyond are really looking at stewardship programs, which really have begun to show some good outcomes. Some interventions, including implementing guidelines for antibiotic prescribing, enhancing education and awareness amongst providers and the public, having more and better decision-making tools in clinical settings are really important. And increasing use of diagnostics in some settings is also very important, right? You have to have the right tools to tell you what it is that you're treating. And at the AMR Industry Alliance, we like to recognize practices in good stewardship. For example, we award a stewardship prize every year for the past, this will be our 3rd year. And so just an example, we awarded the stewardship prize last year to Lekma Hospital in Ghana and the Clinical Engagement Program in Pakistan. And in Ghana, what we saw with Lekma, they decided to embark on an AMR surveillance program. And what they found is that 84% of patients tested in their program were taking antibiotics inappropriately. So now they're working to strengthen their AMR surveillance program, and they've created an awareness campaign to promote antimicrobial stewardship and build capacity with the clinical staff, which includes the doctors and the pharmacists, the nurses, the midwives, laboratory personnel, and community pharmacists. So again, it has to have a multifaceted approach. Everyone has to have a knowledge of what's happening in this space if we're really going to make a change. And then I think another area that is important for progress is in the manufacturing space. Since our inception at the Alliance, we have been working to develop a pathway for antibiotic manufacturers to help minimize any potential contributions to AMR that may arise as a result of the process used to produce the antibiotics, right? So you want to produce the antibiotics to help people. You don't want it to have a negative effect. But as we have talked about, there are multiple sources of AMR in the environment, right? From antibiotic manufacturing to human waste, and from the use of antibiotics in animals to animal waste. And so we're just tackling the one area that we really think we have a role to play. So together with the British Standards Institution, which is a leading authority on standard setting globally, we formally announced an antibiotic manufacturing standard to provide clear guidance to manufacturers to help ensure that the process of creating that antibiotic minimizes the risk of AMR in the environment. And BSI also just announced and launched a certification program earlier this year that enables manufacturers of antibiotics to demonstrate through an independent third-party evaluation that the requirements of these standards have been satisfied. And from that point of view, it really is important to know that the antibiotics are being responsibly manufactured. And so those are a couple of examples where you may not sort of think, okay, here's a specific area we need to take action. Again, we've talked about some of those things in everyday practice, but these are just a few examples of what needs to be done and what is currently being done to help combat AMR, which is driven from so many different sources.
Thanks so much, Melissa. And there's so much that's happening, which is so encouraging because so much needs to happen. So it's great to hear about the different proactive activities across that whole diverse spectrum of challenges. Yehoda, maybe you can comment a little bit about, from your perspective, what more can be done and where do you see some of the biggest opportunities to try and address AMR as we move forward?
Yeah, so I think one thing that I wanted to mention was, the WHO, the World Health Organization's focus on AMR. I mean, as we saw with the COVID pandemic, they provide a lot of global leadership, which sort of pools resources, but also gets global leaders to prioritize pandemics as they arise. And so I think the fact that WHO, I think a few years ago, declared this as one of the top 10 global health challenges is important. I think there have been, ways in which leaders of individual countries are now required to come out with One Health approaches to addressing AMR. I think the huge issue after working in a lot of developing countries for a while now is accountability. We can come up with plans, we can come up with strategies, but there needs to be a way to hold leaders accountable to some of these plans. And so I think that's going to be a huge driver of it. There's data showing, decreased antimicrobial usage among livestock in Europe, but not really in Brazil or other parts of Africa. And so I think the need, the global leadership, I think is really important, but I think the next steps are really in the implementation and the accountability of it. I also think really a global lens to this is important. And so I think Melissa touched on the issue of access in low resource settings. And I work in a low resource setting. Sometimes it feels like a distant problem, but I think it's a challenge that is ultimately going to plague us. And so there's just not the problem of access to antibiotics. There's the issue of access to diagnostics. And so a lot of people just get the antibiotics from a pharmacist without any diagnostics. And it's not by choice. It's sort of their equivalent of a PCP and how you get treated for anything, really. And so I think being able to even have a good surveillance systems predicates on having good diagnostics. So you can actually measure and see what infections you have and what resistance patterns you have. And so I think thinking about ways in which we can expand diagnostics that are low cost to areas where there are high rates of infection would be important. And these are technologies that have been developed for other diseases in low resource settings. And so I think definitely thinking about that point of care or some other rapid testing that can be leveraged in this way to address AMR, I think would also be incredibly important. But to Melissa's point, I think a huge part of this is going to be R&D. It's 17 drugs in the last 10 years is just abysmal. And so I think there needs to be a huge investment in industry, but I also think it's a global health priority that, international organizations and governments should be investing in as a priority area so that we can have more drugs that are being developed as resistance occurs.
Such important points, Yehoda, about driving global action and accountability on this truly global problem. And in fact, next year, the UN General Assembly is convening a high-level meeting exactly on this, bringing together all of the UN member states to discuss antimicrobial resistance alongside the UN General Assembly in September 2024. And as we think about this moment in time, just how dire the situation is, how important it is to drive coordinated action. And as you said, Yehoda, the accountability behind it. What is your perspective? Maybe Melissa, we can start with you. what should global leaders focus on as they're thinking about this huge, huge challenge with so many drivers, so many facets? What should they focus on?
Yeah, what should they focus on is difficult. You're right, because there's so many areas that we need to focus on, again, because AMR comes from so many different places, and so many of us have different roles to play. And I think that's part of it, right? Is that coordination. And I think it has to address an issue as large scale as this, you need political will. And I think the UN high level meeting that will happen in September next year is critical to make sure that we develop that political those political arguments, and that we see that it's coming from the UN, that and other global leaders, that we need to take action. And then we need to work on how we kind of divide and conquer, and figure out the right roles for the right people. So it really is an incredible opportunity to help raise awareness as well on the global policy agenda. And so out of it, as we're thinking about this, we want global leaders to recognize and bring attention to just the immense scale of the threat of AMR to global public health, as we've talked about here today. So many people don't, in a normal conversation, don't know what AMR is, but it is so huge, and it is going to really get worse, as we described, if we're not taking action. So how do we make sure we get it at the top of that agenda, so that then we can help pursue collective work to make really dramatic progress to curb the spread of AMR. So in the lead up to the high level meeting, the AMR Industry Alliance, and hopefully with many of our partners, will be calling on the United Nations and its member states to increase efforts in this fight, of course, against AMR, with stakeholders in the public and private sector to identify and prioritize solutions. And again, that's really challenging, but I think it's important that we mobilize leaders on some real actionable steps. And we're kind of thinking of a number of different areas that are important, and we've talked about all of them already here today. It's first, and these are in no particular order, is ensuring responsible manufacturing of antimicrobials worldwide. Second, to improve the sustainability of antimicrobial R&D, which we've talked about. Third, taking down access barriers in low and middle income countries. And fourth, improving appropriate use of antimicrobials through diagnostics. And Yehoda, you've hit that point strong, and I think it's really critical. And we're looking into that as well, in terms of how our national action plans really helping to pursue and make sure we get the right diagnostics, to get the right diagnosis, to get the right drugs. And then fifth, to enact policies that foster stewardship and appropriate use, which we've talked about here. And this is just how we're thinking about how we need to categorize what our asks are, really, from these global leaders. It's not a small agenda, but this meeting next year, again, is a great opportunity for us to gain traction and come together.
Terrific to get that list so clearly outlined, and hopefully we will see good action, good accountability coming out of that. Yehoda, was there anything you wanted to add? What's your wish list for global leaders?
Yeah, not so much global leaders per se, Melissa. I think that list was really comprehensive, but I think one thing that I wanted to emphasize is that, the people who hold leaders accountable are us. And I think a lot of people don't actually know what AMR is. I hope, this is just a start of a conversation that intrigues enough interest that, the next time people have an infection, they want to find out more whether it was an AMR organism, because it is really that common. But I think, the way a lot of things have changed in history is because the voice of the people, and people have advocated and held their leaders responsible. And so I think as the lead up to, the next General Assembly meeting comes up, I want people to be having more conversations about AMR. It's not sort of in your face, but I think we should start talking about it. This is World Antimicrobial Awareness Week. There'll be a lot of events surrounding it, but I hope it now rings a bell, when people see it, and that we can actually have a huge sort of patient advocacy, and people adding their voices to the discussion, so we can hold global leaders accountable for actually making impactful and sustainable changes to curb the AMR rise.
Absolutely agree. We all have such an important role to play. And I think that's really what I'm hearing from this conversation, is that there is absolutely a role for global leadership. We need the political drive, the accountability. There's absolutely room for healthcare practitioners and providers, for hospital systems, for national authorities to be looking at this. And there is also, just as importantly, a role for people, for each of us to be accountable for our engagement with antibiotics, to be responsible in the way that we are pursuing our own health. I have kids, and I promise you it would be so much easier to just not continue with the course once they're better, but making sure we are sticking with it and making sure we are not being irresponsible with this precious resource that we have, I think is so important. And how we are able to try and have these conversations. Maybe everyone who's seen this today can go home and at the dinner table talk with their family and make sure that everyone's aware of exactly what this growing problem of antimicrobial resistance is, and how we can start to build awareness amongst our own networks, amongst our own families, because every step helps, I think, and we are going to need everybody to lend their voices. Melissa and Yehoda, any last comments before we have to close up with today's incredible conversation? Melissa, over to you first.
I just want to say thank you, and thank you to those who are listening and part of the audience today. I think AMR has impacts, of course, on health at an individual level, at a family level, at a health system level, and it will lead to huge economic impacts as well. And so I think as we look at the future, this is an issue that needs to be at the top of our priority list. So I hope that, again, we've made a little bit of impact in how we're thinking about it, and how folks continue to have it in their consciousness and in their thinking and in their conversations. Thank you so much for hosting it.
Thanks, Melissa. And Yehoda, the last word to you.
Yeah, similarly, I just want to say thank you for having me join this panel, and I hope people can start to have more conversations around AMR. I think it takes education. We did the same thing for COVID. We learned new terms that we weren't familiar with. And I think, this is the next pandemic. It's here. It's a silent pandemic. So it seems more innocuous, but I think we should start having conversations around it. And, it's a pleasure to be able to join both of you to talk about this today. Thank you.
Thank you so much for joining this conversation. I agree with you. Hopefully this can spur others to have conversations. There's a lot of materials available. And so I hope this energizes a little bit all of us to engage more in the conversation. Melissa Mitchell, Dr. Yehoda Martei, thank you so much for joining us today. It's been a real pleasure.
Thank you.
Thank you, Erika.